Okay, so now I'm going to talk about the ganglionic blockers, which are agents that specifically act on the nicotinic receptors of both parasympathetic and sympathetic autonomic ganglia. لأن احنا مثل ما تتذكرون بالمخطط انه النيكوتينيك ريسبتورز يكون موجود بالجنجلية واللي هي تكون in both parasympathetic and sympathetic autonomic ganglia. Some also block the ion canals of the autonomic ganglia. And these drugs slow no selectivity towards the parasympathetic or sympathetic ganglia and are not effective as a neuromuscular antagonists. يعني انه هذه الايجنتس عندما يعني الاكشن هذه الايجنتس show no selectivity towards يعني سواء اذا كانت for parasympathetic or sympathetic لان احنا ذكرنا انه تأثر على البوث وتكون not effective as a neuromuscular antagonists. وهذه drugs block the entire output of the autonomic nervous system at the nicotinic receptors. Except for nicotine, the other drugs mentioned in this category are non-depolarizing and competitive antagonists يعني تعتبر and the response of the non-depolarizing blockers are complex and mostly unpredictable. لذلك الganglionic block is rarely used therapeutically but often serves as a tool in experimental pharmacology. يعني انه احنا ذكرنا انه مثال عليها اللي ذكرنا انه هي تعمل على بلوك النيكوتينيك receptors اللي موجود both in parasympathetic and sympathetic autonomic ganglia without selectivity toward one system وأنه هذه الأجنت ما تعمل على النيوروماسكولار لا تعمل as a neuromuscular antagonist وأنه هذه يعني مثال عليها أنه النيكوتين وأيضا هنالك الأذر agents اللي هي تكون non-depolarizing و competitive antagonists ولكن يكون ال non-depolarizing blockers are complex و unpredictable لذلك هذه agents تكون rarely used as therapeutically advantage ولكن أنه تستخدم as a tool in experimental pharmacology. النيكوتين هو عبارة عن example لهذه الagent واللي هو مثل ما تعرفون انه هو الكومبوننت اللي يكون موجود بالسيجاريت سموك والنيكوتين is a poison with many undesirable action. تعرفون انه النيكوتين has many undesirable action. It is without therapeutic benefit and it's deleterious to health. Depending on dose, so nicotine depolarize autonomic ganglia, resulting first in stimulation and then in paralysis of all ganglia. يعني هذا الأكشن اللي راح يحصل على الجانجليا احنا قلنا موجود النيكوتينيك ريسبتر بالجانجليا لذلك عندما يرتبط النيكوتين ويا الريسبتر اللي موجود على autonomic ganglia بالبداية يؤدي إلى يعمل stimulation بعدها يعمل paralysis للجانجليا. The stimulatory effects are complex and result from increased release of different neurotransmitters as you can see in figure 4 due to the effect of both sympathetic and parasympathetic ganglia. يعني انه هذا الاكشن نتيجة للارتباط راح يكون complex نتيجة حصول الستيمولاتوري effect وراح يؤدي إلى increase the release of several or different neurotransmitters due to the effects on both sympathetic and parasympathetic ganglia. وهذا الفيجر يوضح النيوروكيميكال effects of nicotine مثل ما تشوفون انه مثلا يؤثر على افراز الدوبامين ويؤدي اللي يكون related with pleasure and appetite suppression norepinephrine اللي يكون arousal and appetite suppression as well. يأثر على الأسيتايل-كولين، الجلوتاميت، مثلا الجلوتاميت يكون related بالlearning والmemory enhancement، على السيروتونين اللي يكون عبارة عن mood modulation و appetite suppression، وهكذا. يعني تشوفون أنه يؤدي إلى release increase the release of several on different neurotransmitters اللي هذا الإفكت يحصل نتيجة للإفكت on both sympathetic and parasympathetic ganglia. other groups اللي هي neuromuscular blocker agents، وهذه الدراجز تعمل block cholinergic transmission between motor nerve ending and the nicotinic receptor on skeletal muscle. إذا تذكرون الفقر السابق اللي وضحنا به السايت اوف اكشن، فعندنا بالنيورو ماسكولار يعني بالسكيليتال ماسل موجود ايضا النيكوتينيك ريسبتورز، فهذه الدراجز تعمل على بلوك الكولينرجيك ترانسميشن الترانسميشن between the motor nerve ending and the nicotinic receptor on skeletal muscle. They possess some chemical similarities to acetylcholine and act either as antagonists اللي هي تسمى non-depolarizing or as agonists واللي تسمى depolarizing at the receptor on the end plate of the neuromuscular junction. والنيوروماسكولار blockers تكون clinically useful وتكون مفيدة من ناحية أنه تعمل facilitate rapid intubation when needed due to respiratory failure، يعني عندما نحتاج إلى أنه نستخدم intubation or endotracheal tubes اللي يحصل اللي نحتاجه due to respiratory failure، وأيضا تكون useful to facilitate endotracheal intubation هذا اللي نحتاجه during the surgery and provide complete muscle relaxation at lower anesthetic doses, and this increases the safety of anesthesia by allowing patient to recover quickly and completely. يعني هذه أيضا تكون effective or play a significant role during the surgery من ناحية أنه تعمل facilitate endotracheal intubation و provide complete muscle relaxation. لكن هذه الagents should not substitute for inadequate anesthesia. neuromuscular blocking agents are also used in the intensive care unit as adjuvant therapy to facilitate intubation and mechanical ventilation in critically ill patients. احنا ذكرناها انه هاي تستخدم للintubation والميكانيكال ventilation بالبيشنت اللي هم يكونون critical situation. الفيرست جروب اللي يكون involved in this group اللي هو example of neuromuscular blocking agents اللي هي non-depolarizing competitive blockers. The first known in MP اللي هي يعني رمز للneuromuscular blocking agents اللي example عليها هي non-depolarizing competitive blocker. First known was a curar واللي كان which يستخدم as Amazon hunter used to paralyze prey, and the development بعدها أصبح development للتوبوكورارين followed, but it has been replaced by agents with fewer adverse effects such as cis-atracuran other agent as you can see. The mechanism of action, so at low doses the NMP competitively blocks the acetylcholine of the nicotinic receptor. احنا ذكرنا انه يأثر على nicotinic receptors اللي موجود بالneuromuscular junction. They compete with acetylcholine at the receptor without stimulating it and thus preventing the depolarization of the muscle cell membrane and inhibiting muscle contraction. يعني تشوفون أنه يعمل على inhibit the muscle contraction من خلال أنه competitively block the acetylcholine الموجود بالnicotinic receptors و compete with the acetylcholine receptor without stimulating it، يعني بدون أن يعمل stimulation for it. وهذا راح يؤدي إلى prevention of depolarization of muscle cell membrane، وبالتالي راح يؤدي إلى inhibiting the muscle contraction. هذه competitive action can be overcome by administration of cholinesterase inhibitors such as neostigmine and idrophonium, which increase the concentration of acetylcholine in the neuromuscular junction. Clinicians employ this strategy to shorten the duration of neuromuscular block. وأنه هذه in addition low doses the muscle respond to direct electrical stimulation from peripheral nerve stimulator to varying degrees. وهذا راح يؤدي إلى allowing for monitoring of the extent of neuromuscular block. هاي بالنسبة عنده low doses، لكن at high doses so non-depolarizing agents can block the ion canals of the motor end plate. يعني هنا تعمل على غلق الأيون كانال اللي تكون اللي تابعة للموتور end plate، و this will lead to further weakening of neuromuscular transmission and reducing the ability of cholinesterase inhibitors to reverse the action of the non-depolarizing blockers. يعني احنا قبل شوية ذكرنا انه باللو دوزز ممكن انه نعمل overcome للأكشن competitive action بواسطة اعطاء الcholinesterase inhibitors، لكن بهذه حالة الهاي دوزز this will reduce the ability of cholinesterase inhibitors to reverse the action of the non-depolarizing blockers. الأكشن هذه الagents احنا ذكرنا انه muscle have different sensitivity to block it by competitive agents. For example, a small rapidly contracting muscle of the face and eye are most susceptible and are paralyzed first. يعني هذه العضلات اللي هي تكون بالبداية most susceptible ويحصل بها الباراليسيس، followed by the fingers, limbs, neck, trunk muscle، وبعدها تكون intercostal muscle are affected, and lastly the diaphragm. أوكي، فهذه وعملية الريكفري للمصل تحصل in the reverse manner. Pharmacokinetics, so all NMPs are injected intravenously or occasionally intramuscularly، يعني تستخدم. These agents possess two or more quaternary amines in their bulky ring structure، وهذا يؤدي prevent absorption from the gut. Okay. لذلك هي قلنا injected intravenously و occasionally could be given intramuscularly. They penetrate membrane very poorly and do not enter cell or cross the blood-brain barrier، واللي حاجز الدموي الدماغي. والدراج action is terminated in variety of ways، يعني elimination يحصل in different ways as you can see in figure 5. قسم منها يحصل elimination by the urine، وقسم ممكن انه يحصل لها appear with in bile، وهنالك some agents are metabolized by plasma cholinesterase. The choice of agent depends on the desired onset and the duration of muscle relaxation and the route of elimination. يعني هذه عندما نجي نختار هذه الagents ونحدد أي نوع نحتاج إنه نستخدمه sorry، فهذا يعتمد على desired onset و duration of muscle relaxation and route of elimination. The adverse effects, so in general these agents are safe with minimal side effects. وإذا for more information you can see the adverse effects of the specific NMBs are shown in figure 6 واللي هو shows characteristics of neuromuscular blocker drugs وال red square shows the time to maximal blockade in minutes while yellow square shows the time to recovery 25% of maximal response also in minutes. Drug interactions, so there are several interactions with these agents. For example, it could interact with choline esterase inhibitors. For example, drugs such as neostigmine, physostigmines, and other can overcome the action of non-depolarizing NMBs. However, with increased dosage, choline esterase inhibitors can cause a depolarizing block. وهذا يحصل ال depolarizing block نتيجة لل elevated acetylcholine concentration at the end of plate membrane. If the NMB has entered the ion canal, is bound to the receptor, choline esterase inhibitors are not as effective in overcoming the blockade. يعني هذا ال first example لل drug interaction اللي يحصل between neuromuscular blockers وال other drugs هي ال interaction اللي يحصل ويا ال choline esterase inhibitors اللي مثال عليها ال neostigmine وال physostigmines and other agents as you can see in the slide. The second group of agents or drug اللي يحصل معها interactions اللي هي ال halogenated hydrocarbon anesthetics واللي مثال عليها الديسفلوران واللي act to enhance neuromuscular blockage by exerting a stabilizing action at the neuromuscular junction. يعني هذا يعمل على الانتراكشن ويا هذه الاجنتس يعمل على enhance the neuromuscular blockage by exerting a stabilizing action at the neuromuscular junction. Another type of interaction could occur with the aminoglycosides antibiotics واللي مثال عليها الجنتاميسين والتوبراميسين واللي الانتراكشن بهذه الكيس يعمل inhibit للacetylcholine release from cholinergic nerves by competing with calcium ions where they synergize the competitive blockers and enhancing the neuromuscular blockade. Okay. Last group of interaction could occur with calcium canal blockers, and this agent may increase the neuromuscular blockade by of competitive blockers. يعني أيضا تعمل على increase the neuromuscular blockade of the competitive blockers. السكند جروب اللي هو يكون related لل neuromuscular blockers اللي هي ال depolarizing agents. وهذه ال agents work by depolarizing the plasma membrane of the muscle fiber and similar to the action of acetylcholine. However, these agents are more resistant to the degradation by acetylcholine esterase. هذا الإنزيم اللي احنا قلنا مسؤول عن degradation of acetylcholine and can more persistently depolarize the muscle fiber. يعني هذه الagents اللي هي ال depolarizing agents واللي هي عبارة عن type of neuromuscular blockers يكون الأكشن مالتها similar to the action of acetylcholine لكن إنها تكون more resistant للdegradation اللي يحصل بواسطة acetylcholine esterase وتكون more persistently depolarize the muscle fiber. Example عليها اللي هي succinylcholine. Mechanism of action, so succinylcholine attached to the nicotinic receptor and act like acetylcholine to depolarize the junction. يعني إنه يرتبط مع النيكوتينيك receptor ويعمل نفس لايك الأسيتايل كولين من خلال أنه يعمل depolarize the junction، لكن يكون مختلف عن acetylcholine. So unlike acetylcholine, which is instantly destroyed by acetylcholine esterase, the depolarizing agent persists at high concentration in the synaptic cleft, وهذا will lead to remaining attached to the receptor for a longer time and providing sustained depolarization of the muscle cell. The duration of action is dependent on the diffusion from the motor end plate and the hydrolysis by plasma choline esterase, genetic variants in which plasma choline esterase level are low or absent lead to prolong the neuromuscular paralysis. هذا الأكشن يمر بتو phase. So the depolarizing agent first cause opening of sodium canal واللي يكون associated with nicotinic receptor, which result in depolarization of receptor، واللي هذا يسمى phase 1. يعني هذا الفيس الأول أو الميكانيزم بالبداية تحصل من خلال أنه هذه depolarizing agent cause opening للصوديوم canal واللي تكون associated with nicotinic receptors، و this results in depolarization of receptor, and this called phase 1, and this lead to transient twitching of the muscle or fasciculations. After that, so continued binding of the depolarizing agent render the receptor incapable of transmitting further impulses, and with time the continuous depolarization gives way to gradual repolarization as the sodium canal close or is blocked. يعني هذه بالمرحلة الثانية راح يحصل with time راح يحصل continuous depolarization، this will lead or gives way to gradual repolarization as the sodium canals close or blocks, and this cause resistance to depolarization and flaccid paralysis واللي تسمى phase 2. okay يعني sorry يعني هنا عندنا two phase اللي هي الفيس 1 اللي تحصل نتيجة ال opening of sodium canal اللي تكون associated with nicotinic receptors، واللي تؤدي إلى depolarization of the receptor، وتؤدي إلى transient twitching of the muscle or fasciculation. والفيس 2 اللي يحصل نتيجة إنه continued binding of the depolarizing agent يؤدي إلى renders the receptor incapable of transmitting further impulses, and with time continuous depolarization give ways to gradual repolarization of the sodium canal as sodium canal closed or blocked, where this caused resistance to depolarization and flaccid paralysis واللي يسمى phase 2. الأكشن as with the competitive blockers, so the respiratory muscle are paralyzed last, where succinyl choline initially produce brief muscle fasciculation that cause muscle soreness, where this may be prevented by administering a small dose of non-depolarizing neuromuscular blocker prior to succinyl choline. يعني هذا الأكشن إذا نحتاج إنه to be prevented, in this case we need to administer a small dose of non-depolarizing NMP prior to succinyl choline. The duration of action for succinyl choline is extremely short, this due to the rapid hydrolysis by plasma choline esterase, where succinyl choline that reaches the neuromuscular junction is not metabolized, allowing the agent to bind to nicotine receptors, and redistribution to plasma is necessary for metabolism. Okay, so succinyl choline reaches the neuromuscular junction, is not metabolized, where this allowing the agent to bind to nicotine receptors, and redistribution to plasma is necessary for metabolism. The therapeutic uses, as I said before, it is because of its rapid onset of action, so succinylcholine is useful when rapid endotracheal intubation is required. يعني بهذه الحالة يستخدم بما أنه rapid onset of action. It also used during electroconvulsive shock treatment. So, for the pharmacokinetics, so succinylcholine is injected intravenously. Its brief duration of action results from redistribution and rapid hydrolysis by plasma cholinesterase, where drug effects rapidly disappear upon discontinuation. يعني إنه هذه الagents تعطى as IV injection، وإحنا ذكرنا إنه يكون rapid onset of action، لذلك تكون brief duration of action، وهذا يحصل نتيجة للريديستريبيوشن والرابد هيدروليسيس بواسطة البلازما كولين استريز، وإنه الإفكت لهذا الدراج راح disappear، يحصل له disappear upon the discontinuation. Adverse effects, so there are several or number of adverse effects which are related with this drug. For example, hyperthermia واللي يكون potentially induced malignant hyperthermia in susceptible patients. يعني in this case susceptible patient راح نشوف induced malignant hyperthermia. Second, we can see apnea, which is temporary cessation of breathing. واللي يكون administration of succinylcholine to patient who is deficient in plasma cholinesterase or has an atypical form of the enzyme can lead to prolonged apnea due to paralysis of the diaphragm. وأيضا rapid release of potassium may also contribute to prolong the apnea in patient with electrolyte imbalance. In patient with electrolyte imbalance receiving digoxin or diuretics، يعني for example اللي هم heart failure patients، بهذه الكيس succinylcholine should be used cautiously or not at all. Lastly, it could cause hyperkalemia, so succinylcholine could increase the potassium release from intracellular stores، وهذا يكون particularly dangerous ب specific type of patients, for example in burn patients and patients with massive tissue damage. بهذه الكيس or in these patients in which potassium has been rapidly lost, or in patient with renal failure. Okay, so this is the end for the lecture of today. Thank you very much for your listening, and if you have any question or need any clarification about the topic, just feel free to ask.